The Arc Jacksonville supports individuals with intellectual differences achieve their full potential. So whatever that means for all of us. If what we want to do is to work and live independently, that's what we help people do. If they need more supports to live safely and meaningful lives, that's what we do. We support people with a variety of disabilities. So it could be cerebral palsy, Down syndrome, spina bifida, autism, anything that really happens at or near birth.
Okay, very good. So what factors make someone high risk for dementia or Alzheimer's disease-related dementia?
So people with intellectual differences are at an increased risk, but specifically individuals with Down syndrome who tend to live with their caregivers are at a 50% higher risk than you or I. So a much higher risk for those individuals. And now as life expectancy has increased, we're seeing that more and more. Someone with Down syndrome when I was born might be expected to live into their 20s, and now we see people living into their 60s. So getting dementia in your 40s suddenly becomes a new thing kind of in our world today.
What's that look like in Jacksonville? What's that look like in our community? How bad is the problem?
So I'll tell you, I started in this field about 8 years ago, and one of the first parents that I ever talked to, a mom came to my office and said her son had worked at Publix his whole life, had lived alone, and had found himself recently in a group home and really declining due to dementia. He was no longer working, and he went into the hospital, and the group home said, we can no longer care for him. His dementia has gotten to a point where we don't feel like we're capable of caring for him, which was not wrong of the group home to say. But she was in a crisis, and this was just 8 years ago, and I'll tell you, that was my first year on the job, working with people with disabilities, and I could tell you 10 more stories like that, just that I have personally talked to families that have had that sort of experience. And really, the program that we started is a standalone center, and it's named after Kimberly Smoke Palmer, and her story is really similar. She really lived the dream. She actually lived alone. She worked. She got married, did everything we all want to do. And then at 50, she really had a kind of a sharp decline in her abilities. And the family had nowhere to turn. Most memory care places don't feel like they're equipped for people with Down syndrome. And those of us that serve people with Down syndrome aren't necessarily equipped for people with dementia. So we're really trying to bridge the two communities at this point.
Yeah, it almost feels like people aren't equipped at all until they run into the situation where they have to become a caregiver for someone with dementia or Down syndrome. And so, they need all of the support and information they need in that time. How difficult is it for people to accept or I guess find your programs when it's their time to need the services?
Right. Well, we're one of the first in the country. So a lot of what we're doing now is just trying to start that dialogue early with families. And this program in particular does have two aspects. We're caring for the individual through all sorts of modalities, but also for the caregiver. And part of that is just people at high risk. So yes, if you have a diagnosis, we have a line of programming for those people. But if you're at high risk, which for someone with Down syndrome is anyone over the age of 30, we really want to get you in when you're at your best and let us help you retain the skills you have, help start screening you so if there does start to be a gradual decline, we see it, because there are things we can do to minimize the impact, and there are things we can do to help caregivers manage symptoms. So although we definitely are here for people who have a diagnosis, really our point now, and really kind of trailblazing for the country in Jacksonville, is trying to get to people sooner so that we can manage and help people live alone potentially longer.
I had a relative with dementia, but he was older. He was in his 80s. And at the time, and it just seemed like, we figured that it was something wrong. But you were talking about people who are much, much younger. How do people know they need to start looking for dementia at an earlier age?
Well, if someone has Down syndrome specifically, we really would like to see an annual screening at 30. Because there is early onset. And that gives us, and we're able to do that, we help families do that, really just a baseline. What can they do today so that if there's suddenly a decline, we know this has nothing to do with their Down syndrome, because they could bathe and work 5 years ago, but now they can't.
Right.
Where a lot of times professionals, even the best professionals, just assume it's related to their disability and don't see that gradual decline. So it does make it almost a little harder to pick up on for the people we support, and it generally is a lot earlier. Right. So as early as late 30s, early 40s. More commonly, you're talking 50s or 60s, but it does happen extremely early.
Is it an expectation for most Down syndrome people?
Yes. So right now, life expectancy for someone with Down syndrome is in the mid-60s, And if someone makes it to their 60s, 90% of people with Down syndrome will have dementia.
Okay. So, so talk a little bit more about the specific aims of the program and why it's important to have this in Jacksonville. Like you mentioned, you're sort of first at this, right?
Right.
So, I want the community to know how special this is, right?
Yes.
So, because we're trying to make sure that we provide a service to people who feel like they have no place else to go.
Right. So the aims of the program, it's really a dual approach. So it is focusing on the individual and helping them live the best life they can live, but it is equally focused on caregiver support, and that's really kind of the next step. And we received a large grant to launch the program, but since then we've really been focused on partnering with our community partners. We just received a grant from Baptist Health to help kind of continue the efforts, because we realize we are not the experts necessarily in dementia. We are the experts in individuals with differences. So we really want this to be a community partnership that can be modeled across the country. And we have so many great resources in our healthcare community here in Jacksonville that we can lean on and really offer more for families and the individual to help people really just continue to live at their full potential.
Can you talk a little bit more about caregiver support? What are some of the challenges that they may run into? Because they are the ones who are sort of sheltering the burden of taking care of people, that are transitioning from their diagnosis into treatment options or the program. What is it they're up against, and that their expectations should be as they move along, they try to help their loved ones?
So some of the things we see that we really can help with is behavioral symptom management. So as someone gets dementia, different behaviors start to emerge, and that's true for everyone who gets dementia. So helping the caregivers learn strategies, things to do, things not to do. We all know there's triggers when people have behavioral episodes. But then secondly, there's the respite component. I think anyone who's been a caregiver knows that you need that time to recharge and to continue to care for the person. And oftentimes the parent will be the primary caregiver for the duration of that person's life. So our center allows somewhere for the individual to go during the day to learn and to still do activities that are meaningful. But really a huge benefit of the center is that the parents or the caregiver get a time of respite and a time of relief. And we've already had, the center's been open for about a month. We have 20 people currently attending, and we've had family members say they have seen drastic improvements in how they're handling behaviors, and it's only been 4 weeks. So we really think we can make a difference for these individuals and help many people in our community really cope with something that none of us are born knowing how to do, and no one should be expected to know how to do it.
Okay, great. Give us your contact info real quick for the program.
So you can reach us on our email at sas@arcjacksonville.org, or you can find it on our website, arcjacksonville.org/SAS.
All right. Thank you very much. Kari Bates.
Thank you.
Arc Jacksonville. Thank you.